Well, welcome to this month's Leading Lab. If we've not met, I'm Sherry Yellin, and I'm passionate about leading. I'm passionate about teaching people about how their brains work so that we can work with our brain rather than against it. But I'm mostly passionate about equipping leaders to be leaders worth following. We do a monthly session for our community of leaders, and it's a time we call the Leading Lab on purpose. It really is for us to come together, learn about a focused topic around leadership, give you some practical ideas so you can go out and experiment and do your own lab, and then come back together the next month and build on that. This month's Leading Lab is really special to me. I think it's one of the most important topics that we should be talking about, but we're not talking about. I want to start out with this idea. Organizations don't fail because people don't know. They fail because the people who know don't say it. So much of our time is spent talking about communication. We do workshops on all sorts of communication assessments. We do workshops on trust and innovation and so many different ideas. But at the core of it is really about communication. And today's focus I really wanted to take was around when communication doesn't happen. What is the cost of silence? And so, in this leading lab, we're going to walk through three guiding questions. Most importantly, what is the cost of silence? What is silence costing you personally? What's it costing your team? What's it costing your organization? Second question is, so what perpetuates silence? Why would we choose silence over speaking up? There's some great research around that. But finally, what are some practical ways to break the silence and to make the invisible visible? And we've got a lot of good learning from many different industries. So I get the privilege of running the Yellin group. We do all sorts of workshops and coaching and instructional design and team building. So, in any of these leading lab topics, if you need support in implementing this or to understand more about it, just give us a call. That's the quickest way. Or you can check out our website at yellingroup.com. Back to this idea. Organizations don't fail because people don't know. They fail because the people who know don't say it. And we could replace this word organizations with many different words. We could replace it with systems. Systems don't fail because people don't know. We could replace it with cultures. Cultures don't fail because people don't know. We could replace it with countries. Countries don't fail because people don't know. They fail because the people who know don't say it. We could replace it with teams, with projects, with your hopes and dreams. And we could replace it with our families. Our families don't fail because people don't know. They fail because the people who know don't say it. And really, it could apply to any relationship in your life. It's such an important topic. So I want to start out with question number one, which is, what's the cost of silence? And when we think about what we've been brought up to, and we're told, what do we not talk about? When I think about growing up, my mom would often say, don't air your dirty laundry. You pass people in the hallway and you ask how they're doing, and they're going to say, fine. We're told not to talk about our feelings or what is really going on. Sometimes we're told not to talk about challenges that a team is having or a company's having. And because of that, we don't get to really good solutions. I'll tell you personally, I think about for many, many years, I was in a living situation that was really, really hard. And when it all kind of came to the surface, some of my very best friends, like lifelong friends, were shocked because they had no idea because I'd covered it up so well. So there's so many things that we're told not to talk about, and there's a cost to that. For example, we know now if we don't talk about trauma, then our health can suffer from that. If we don't talk about the challenges maybe your company or your team is having, you don't get access to solutions that could maybe so easily solve it and cause it from being so much worse. I was at an event 2 weekends ago that made a powerful impact on me. And it was an event that was hosted by SAVE, which is a suicide awareness organization out of Minneapolis. And I know we have a lot of people that listen in and attend our leading labs that are in construction. And I do want to highlight that they have a branch of this organization that's dedicated to suicide prevention for construction. And you may want to go check that out. It's a really great organization. And so this was a fundraiser for them, and it was the first time that I'd ever been to one of their events. And one of their board members spoke, and she not only is involved in this organization, but she's a mom. And she's a mom of one of her daughters named Kayla, who unfortunately took her own life. And she had the courage to stand up that night and talk about what happened. And her daughter was walking across this bridge. There was a lot that was going on in her life, and she jumped off the bridge. And so it's a heartbreaking story, but she talked about that to the crowd. And she said that after she got that call, she had to go to that bridge. And when she went to the bridge, she was shocked to see how low the railing was. And you can see that in this picture. This is the bridge that she was walking on. And she thought, what if there had been a barrier? Or what if this had been even a little bit higher? Would it have prevented what might have been an impulsive moment? So she started asking around, and she learned that 2 to 5 people a year jump off this bridge and take their life. But nobody was really talking about it. And so she took it upon herself to meet with legislators, and now she's getting legislation passed so that bridges have a barrier. And I think, one day, maybe every bridge in this country will have to be built with a certain barrier of a certain height because she had the courage to talk about it. And when she was meeting with one of the legislators, he said, this should have been changed 50 years ago. So you wonder, what's the cost of being silent on the things that sometimes we maybe have shame about or grief about, we don't talk about? We often shared this story in one of our workshops. And if you've been in one of those, you may remember this story. It's a tragic story. This is the Champlain Towers that were built in Florida, and these were built in 1981. But it's a fascinating, though tragic story because there's so much silence that happens from the very builder who had been disbarred from Canada. He had no background in construction. He really had no business overseeing the construction of this building in the first place. But then we learn that the building inspection department for the city had a history of making unethical decisions, of not speaking up, of kind of underhanded deals. Even when the residents started to see deterioration in the building, some filed a complaint, but they really didn't speak up in a way that got attention. And through the years, they had actually brought in consultants and other engineers to inspect the building, and they would find grave concerns, but they didn't speak up. And the result of that silence over 40 years was the claiming of 90 something lives and a very tragic event. Yeah, another example of the cost of silence even comes from the Columbia. So it took off on January 16th of 2003. And since then, engineers have spoken up that when it took off, they knew that there was debris that came off the shuttle. And I will actually read an excerpt from one of the interviews with one of the engineers. The managers believed the foam strike wasn't serious, but the engineers felt like something was wrong. But this one engineer that had been interviewed said, I couldn't push hard enough. I felt like I was a little person in a big system. I worried that challenging senior managers too forcefully could damage my career. So the concern was never escalated. And as we know, 16 days later, when they were re entering, it exploded over Texas. And if you're in Texas, you probably heard that if you were around on February 1st, 2003. Another just extreme example of the cost of silence. And in healthcare, there are events that are called sentinel events. And sentinel events are the definition is that when an unexpected incident that is serious results in death or permanent harm. So we're talking things like wrong side surgery, wrong side amputations, wrong injections of medications. And oddly enough, we sometimes think of the word sentinel today as like a guard, but really the real meaning of sentinel is a signal that something in the system has gone wrong or needs urgent attention. It's a feeling or perception. And so a lot of research has been done in healthcare to identify what's the root cause of these sentinel events. Why are people missing these moments or not speaking up? Well, and that is one of the driving forces behind it is the human factor, the lack of communication, the lack of creating an environment where people feel safe to speak up. So I wanted to dig into for a minute, why is this? What perpetuates silence? And to that, I always have to return to the equipment that's driving everything, which is the human brain. What causes us to remain silent? Well, we know that the prefrontal cortex in your brain is the part of your brain that allows us to have ideas and to have willpower, to have empathy, to see from different perspectives. But it's only going to operate when we feel safe. What can shut down that part of the brain is threat, and not all threat, but specifically negative threat. And negative threat has three very distinct characteristics. One is there's some element of confusion or uncertainty. So think about if you are that engineer in that room or a nurse in that operating room, there's some uncertainty that comes with speaking up. Negative threat is also when we don't feel like we have a lot of choice or voice or agency. So maybe you're not the person in the room with the title. So you don't feel like maybe you have the credibility to speak up. And then the final characteristic of negative threat is when we feel like there's negative consequences that will occur in the situation. So certainly we don't know the consequences of giving somebody feedback. We don't. We don't know the consequences of speaking up. And for that reason, we often withhold feedback. I'm kind of the thought of I'd rather give the feedback and, kind of piss somebody off rather than withhold the feedback. And now we're not in service to that person. But it just shows you that, man, speaking up sometimes is going to trigger all characteristics of negative threat. We're going to have to face uncertainty. We are going to have to face the fact that maybe we don't have a lot of voice and choice over the consequence of that. And therefore, sometimes in that moment, we resort to silence. So your brain's always asking, am I safe? And anything that's going to jeopardize that is going to be something that we're going to have to kind of train ourselves to push through because we have a deep need for safety, a deep need for certainty, a deep need for familiar. So just know that speaking up is probably going to feel really uncomfortable, but that doesn't make it wrong, just makes it uncomfortable. Another interesting fact about your brain is this need for belonging. So, in addition to that safety and comfort and familiarity, we have this deep need for belonging. In fact, social rejection is one of the number one threats. And we know from research that brain scans of social rejection and brain scans of physical pain are virtually identical. So when we feel like we don't belong, it kind of lights up the pain circuitry in the brain. Well, guess what? Speaking up, going against the flow, challenging status quo, especially when it might be expensive or inconvenient or unpopular, we are risking social rejection. So know that your brain's going to do everything it needs to do to feel safe and to feel like there's a sense of belonging. So that definitely perpetuates us resorting to silence. In the moment, maybe it just seems easier. But there's another phenomenon called the diffusion of responsibility, or maybe a more simpler way of describing it is the bystander effect. And this was studied after there was another tragedy in which a lady was murdered, and bystanders heard it, but no one came to her aid. And so there were a couple of researchers in the 60s actually who wanted to study this, why people do this. And so what they did is they designed a series of controlled laboratory experiments. And in one of the famous versions of it, participants were placed in separate rooms and told they were participating in a discussion with other participants through an intercom system. But there weren't really other participants over there. They were pre-recorded voices that were being piped in. So during the discussion, one of those voices suddenly began to sound distressed and eventually said they were experiencing a seizure and they needed help. So what they were looking for is how many participants would actually come to that or try to come to that person's aid. And the results were really striking because when participants believed that they were the only person who heard the emergency, 85% of them attempted to come to that person's aid. But when they believed that four other people were present, only 31%. We're just expecting somebody else to do it. And I'd like to pass judgment on these people. But I know personally, there have been times where I chose silence because I thought somebody else will catch this, or somebody else with another title or more experience or older or younger, whatever it is, will take ownership of it. And so this idea of social influence, of looking to other people for cues, is really important to our brain. And so what we know is that sometimes the people who speak first and speak the most in a meeting have the most influence in that meeting. So my third question, which is really where I want to get to, is, well, what are practical things that we can do? Like, what are practical ways that we can create a culture where people do speak up? What are practical ways that we can do for ourselves to maybe break the silence to avoid the cost of silence? And there's so much great research from medicine because healthcare wanted to dig into these sentinel events and wanted to find out what was the root cause, but they also wanted to find out what do we do about it. And so here's a TED Talk by Atul Gawande. I'm assuming I'm saying his name correctly, but he's the author of The Checklist Manifesto, How to Get Things Right. And he's talking about what the World Health Organization created when they started studying other industries. So there's a couple of things that I love here. First, the practical suggestion, but also the reminder that let's keep looking to other industries for best practices and new ideas. I know that we get to work across industries, and I love that because we do get to pick up different ideas from different places. But one thing that I see is going kind of back to that familiar is we tend to get stuck in our own industry and we stop looking outside of our industries for creative ideas or best practices. So I want to play this for you. We'll take a listen to what he has to say.
I got interested in this when the World Health Organization came to my team asking if we could help with a project to reduce deaths in surgery. The volume of surgery had spread around the world, but the safety of surgery had not. Now, our usual tactics for tackling problems like these are to do more training, give people more specialization, or bring in more technology. Well, in surgery, you couldn't have people who are more specialized, and you couldn't have people who are better trained. And yet we see unconscionable levels of death, disability that could be avoided. And so we looked at what other high-risk industries do. We looked at skyscraper construction. We looked at the aviation world. And we found that they have technology, they have training, and then they have one other thing. They have checklists. I did not expect to be spending a significant part of my time as a Harvard surgeon worrying about checklists. And yet what we found were that these were tools to help make experts better. We got the lead safety engineer for Boeing to help us. Could we design a checklist for surgery, not for the lowest people on the totem pole, but for the folks who were all the way around the chain, the entire team, including the surgeons. And what they taught us was that designing a checklist to help people handle complexity actually involves more difficulty than I had understood. You have to think about things like pause points. You need to identify the moments in a process when you can actually catch a problem before it's a danger and do something about it. You have to identify that this is a before takeoff checklist. And then you need to focus on the killer items. An aviation checklist like this one for a single-engine plane isn't a recipe for how to fly a plane. It's a reminder of the key things that get forgotten or missed if they're not checked. So we did this. We created a 19-item, 2-minute checklist for surgical teams. We had the pause points immediately before anesthesia is given, immediately before the knife hits the skin, immediately before the patient leaves the room. And we had a mix of dumb stuff on there, making sure an antibiotic is given in the right time frame because that cuts the infection rate by half. And then interesting stuff because you can't make a recipe for something as complicated as surgery. Instead, you can make a recipe for how to have a team that's prepared for the unexpected. And we had items like making sure everyone in the room had introduced themselves by name at the start of the day, because you have half a dozen people or more who are sometimes coming together as a team for the very first time that day that you're coming in. We implemented this checklist in 8 hospitals around the world, deliberately in places from rural Tanzania to the University of Washington in Seattle. We found that after they adopted it, the complication rates fell 35%. It fell in every hospital it went into. The death rates fell 47%. This was bigger than a drug. and it's been slow to spread. This is not yet our norm in surgery, let alone making checklists to go on to childbirth and other areas. There's a deep resistance because using these tools forces us to confront that we're not a system, forces us to behave with a different set of values. Just using a checklist requires you to embrace different values from ones we've had, like humility, discipline, teamwork. This is the opposite of what we were built on: independence, self-sufficiency, autonomy. I met an actual cowboy, by the way. I asked him, what was it like to actually, herd 1,000 cattle across hundreds of miles? How did you do that? And he said, we have the cowboys stationed at distinct places all around. They communicate electronically constantly, and they have protocols and checklists for how they handle everything from bad weather to emergencies or inoculations for the cattle. Even the cowboys are pit crews now. And it seemed like time that we become that way ourselves. Making systems work is the great task of my generation of physicians and scientists. But I would go further and say that making systems work, whether in healthcare, education, climate change, making a pathway out of poverty, is the great task of our generation as a whole. In every field, knowledge has exploded, but it has brought complexity. It has brought specialization. And we've come to a place where we have no choice but to recognize, as individualistic as we want to be, complexity requires group success. We all need to be pit crews now. Thank you.
So you can see that a couple of points that he says that really connected with me, maybe hopefully it does with you, is to identify the pause points. And pause points for the key things that get forgotten. So what he's basically trying to tell us and what we can learn from these different industries is that a culture of speaking up doesn't rely on courage. Because we know from the brain, you may not have it in the moment. It relies on a system. And I know we have a lot of people in our group from many different industries. So I wanted to put together, a checklist, a checklist that you could adopt based on what those pause points are in your industry. And let's just take this checklist into meetings for this example. Even in meetings, it's very common for us to create an agenda for a meeting. But what if we had a checklist for a meeting? And so the V in my VOICE acronym for this checklist is to verify the moment, verify the pause points, identify those moments where key things get forgotten or where there are key moments where decisions are going to be made. So you might define the moments within that meeting where silence could cost, where you need to bring forth the invisible. And you're not building a checklist for the entire meeting, you're building a checklist for the moment, right? When silence is costly. So a couple of questions that you might ask is, what is a moment when silence could cost us? Or what decision are we about to make? So verify the moment. Second part of this checklist is open the space. In other words, make it safe for people to speak up. And that is so much under the influence of the leader, actually the highest paid person in the room. We call that the hippo, right? The hippo can sit on an idea and kill it. The hippo can perpetuate silence, or the hippo can open up the space and make it safe. It's the leader that has to model humility and make it safe to speak. One way to do that is speak last. So you might actually use words like, we may be missing something, so let's surface concerns. Or even saying specifically, it's safe to challenge this. We need everyone's thinking. So open the space, making it safe for people to speak. Just another add on that's very interesting from the research is if people speak first in a meeting, then they're more likely to speak later in the meeting. So just opening up your meeting where each person is going around and saying something doesn't really matter what they say. It's just the very fact that they are saying something. So, for example, in some of the surgery rooms, even though they may know each other, they still do a quick introduction because they know that if people speak early on, they're more likely to speak later on. So you want to verify the moment, you want to open the space. The I here is to invite the invisible. Here's where we want to uncover the silence. And one best practice is to speak in turn rather than, popcorn style, which we often do. But what happens in that is some voices dominate and others get shut down. So if we expect each person to voice a concern, each person to speak, we're much more likely to uncover the invisible. So asking questions like, what concerns do we have? And what else? And what else? And I'm fine with calling people out. Jim, what concerns do you have? Jane, what concerns do you have? Who sees this differently is another good question. One of my favorite is, what feels risky to say, but really needs to be said? So invite the invisible. I will tell you too, if you have new people on your team, man, they have fresh eyes. They're going to be able to see things from a perspective that you don't have anymore. So really invite those voices to speak. So we want to verify the moment, open the space, invite the invisible. Here we want to confirm every voice. Ensure, again, everyone speaks and don't be afraid to single people out. What concerns haven't been voiced is a good question. What else are we missing? And then to validate when people do speak up. Excellent point. Your perspective matters because we want to create that sense of belonging. And then the E here is to encourage more of it, right? And continuously encourage dialogue and safety, but also have a clear path forward. So we want to elevate the next step. So it might sound like this. Thank you, everyone, for sharing your insight. This is how we will move forward. And then before you move forward, what else have we missed? And what else? So I want to leave you with one question because I think this idea of recognizing what is silence costing, but even better, how do we create an environment where speaking up is the norm? It's not relying on courage, it's relying on a system. So my final question for you is, what is one thing in your organization or your relationship or your family or your team or your project? What is one thing right now that concerns you but hasn't been fully said? Leaders go first in the way of speaking up if you need to, right? And they go first in creating a culture where people feel comfortable and they feel safe and they feel valued in speaking up. So thanks for watching this Leading Lab. We do this the third Tuesday of every month from 8 to 8:45 a.m. No cameras required because a lot of people are driving in and they're listening in. We take a topic, and next month we're going to be talking about maintaining calm and chaos. So I hope that you can either join us or watch the recording after. Thank you.